Like every winter morning, a thick, toxic fog envelops the Indian capital. Delhi's 30 million inhabitants wake up to a cloud of pollution. Unbreathable air has become Namrata Yadav's worst nightmare.
When you step out, it's just burnt charcoal. It's soot. I don't know how to describe it better, but that's how it smells like in the morning.
Every few hours, she checks the air quality index. This morning, pollution dropped to levels considered dangerous to breathe.
So the AQI right now is 591, and the PM 2.5 is actually 371.
The level of fine particles in the air is 25 times higher than the limit recommended by the WHO. Invisible to the naked eye, these particles are harmful to health. Namrata has bought several air purifiers.
It is beyond dystopian because I've created a bubble around me, a clean air bubble, and I have been able to do it because I'm privileged. Better part of Delhi can't even afford the most simplest of air purifiers. Very often people tell me, then leave Delhi. But Delhi is my home. Why should I leave Delhi?
The family's life has been confined to their home. Each pollution spike disrupts her life and that of her 7-year-old son, Abhir.
Once the AQI level spiked, we've stopped going for any outdoor activities. I am waiting for instructions from the school whether am I to send him to school tomorrow, or I'm not to send him to school, or am I to log on to the computer and where he will be taking his classes from. We cannot normalize this for the sake of our children, for the sake of their futures.
For nearly a decade, New Delhi has been ranked the world's most polluted capital. Over the past 2 years, the city has not recorded a single day of clean air. The sources of pollution are well known: vehicle emissions, construction activity, coal-fired power plants, and crop burning by farmers in neighboring regions. In winter, the situation intensifies as plummeting temperatures and stagnant wind trap fine particles. The smog irritates the eyes, triggers headaches, dry coughs, and respiratory distress. During each peak, hospitals see a surge in patients suffering from asthma and bronchitis. Among them is this elderly woman who has been admitted for the 4th consecutive year.
She's requiring fairly high support on what we call a non-invasive ventilator. And the oxygen levels are maintained, but her carbon dioxide levels are going up, which happens in the lung diseases related to pollution, etc. happens.
Dr. Sumit Ray is the medical director of the intensive care unit at this hospital. In recent years, he has observed how damaging fine particles are to all parts of the body.
So these particulate matters get into the bloodstream, and they cause damage to the arteries. They cause an inflammatory response, inflammation in the body. They trigger an inflammation, and this inflammation gets carried throughout. And blood vessels are everywhere, right? Blood vessels supply every organ of the body. So this inflammation of the blood vessels lead to damage to every organ eventually.
Pollution also increases the risk of heart attacks and strokes, diabetes, neurological diseases, and lung cancer.
The incidence of lung cancer in non-smokers, the evidence suggests that 1 in 3 lung cancers in India are probably not related to smoking. So what could be the other cause? Carcinogens, maybe, and also primarily pollutants, which are also carcinogens.
According to multiple studies, Delhi's toxic air can shorten a resident's life expectancy by up to 8 years. This pediatrician is already seeing the devastating impact of pollution on early childhood growth.
Yesterday, she was unable to speak sentences. Now she is much better.
Pollution hits children even before they are born.
Damage starts right when the baby is in the womb. Okay, and when the baby is born, and when these repeated 4 to 5 months every year of very high pollution certainly has some long-term effect on the lungs. So we do see children whose lung function is probably much less than what is expected for their peers who might be living in a different cities with a much better air quality.
While this toxic air spares no one, it is widening existing inequalities. In North Delhi, the Bhalsawa neighborhood is home to one of the city's 3 main landfills. Nearly 300,000 people live around a 60-meter-high mountain of garbage. Among them is the community of waste pickers. Shefali Goel works for the NGO Chintan, which helps some of the most disadvantaged urban communities.
नमस्ते सभी को कैसे हैं आप लोग
A survey by the NGO reveals that 75% of waste pickers suffer from reduced respiratory capacity. This is often due to lung diseases caused or aggravated by air pollution.
My breathing goes up and down, then up again. We started coughing up blood because of the breathing problems.
This morning also?
Yes, this morning too.
Sonia has become asthmatic because of the air pollution. She often gets asthma attacks, and she's facing a lot of issues right now. Pollution affects everyone. It's worse in winter when people heat their homes by burning garbage. And then in almost every household, you also have people suffering from tuberculosis.
Toxic fumes from the open dump site poison Bhalsawa's rat pickers like Ruxana. A hazardous cocktail of methane, carbon dioxide, heavy metals, and of course, fine particles is spread through the skies of the Indian capital, a place Ruxana has called home for the last 25 years.
It doesn't feel good to work in pollution, but what can we do? It has to be done because we don't have any jobs, no means to earn anything, no other source. But if we stay at home, how will we feed our children and our families? How will we earn a living to support our families? We want the government to do something for us. When the pollution is so high, the government should at least provide us with rations, medical facilities, and use some resources from its side to reduce pollution so that we don't have to face such high levels.
Organic decomposition in the sun often triggers fires. Just 20 meters away, rat pickers are burning waste to extract recyclable materials.
They're burning cables there to recover the metal they're made of. From morning till night, they climb this mountain of garbage, make small piles of waste in several places, and set them alight to collect materials that they then resell to make a little money. Except that this adds to the pollution, especially in the direction of their homes.
As the health crisis worsens, public outcry is mounting over government inaction. Leading the charge is environmentalist Vimlendu Jha.
Still business as usual. City is going to work, people are going to schools, people are going to offices, as if it's totally okay to breathe this 350, 360 AQI.
We follow him to the city's pollution hotspot in northeast Delhi. More than 300,000 commuters pass through this transit junction every day. Within minutes of reaching here, Vimlendu spots something bizarre.
Water is being sprinkled everywhere. Less than half kilometer from the air quality monitors, you actually settle all the dust so that your readings are all managed.
The environmentalist alleges that the government is manipulating pollution data by using these water cannons. The aim, he says, is to artificially lower the pollution index by forcing fine particles to settle on the ground.
They've actually sprinkled water everywhere in front of an air quality monitor, which is, there are 39 air quality monitors that we have in Delhi.
The reliability of these air quality monitoring stations is increasingly being questioned.
When you talk about pollutants settling, what you and I are breathing, we're not jumping and breathing up. We're breathing the air that is here. And therefore, for me to know what my air quality is, should be the air quality monitoring station or monitors should be at that level. That's one. Two is that it should not be surrounded by greenery to give you a fake understanding of how clean the air is.
Among the measures implemented by the previous Delhi government is this 25-meter-high smog tower equipped with 40 giant fans. Built in 2021, it is located opposite the monitoring station, a staggering €2 million project.
I call this voodoo science. If it cleans the air, it will only clean the air or perhaps maximum around 200 meters or say 1 square kilometer. Hiding pollution data of these levels is criminal neglect, it's bad governance.
The BJP, the Hindu nationalist party that came to power in India in 2014, has been in charge of Delhi since 2025. It has been under a wave of criticism both for its failure to act and the spread of misinformation as echoed in the Indian Parliament last December.
In a written reply in the Rajya Sabha, Environment Minister Kirti Vardhan Singh said there is no conclusive data linking high air pollution levels to lung illness.
Despite several requests for comment, only Delhi's Environment Minister agreed to talk to us. While acknowledging that the city's pollution has reached a crisis point, he blames the opposition party that governed the capital for the past 10 years.
So this mess has been created by the Aam Aadmi Party. It is not by us. The water sprinklers were bought by them, hired by them. We are only running them. Thirdly, all AQA stations were placed by them. We have not put up a new AQA station. All data monitoring system was created by them. It's the same system. We have not changed anything. So this is just a blame game, nothing more than that. We do not want people to have bad air, to have this kind of dirty air. But yes, the problem cannot be fixed in just a second. It is not possible. It will take another 2 to 3 years to have such a kind of air which is good for your health.
For now, the government's long-term plans remain unclear. The authorities are taking quick fix measures without addressing the root causes of what has become a national problem. According to a recent scientific study, air pollution is now a silent killer, claiming more than 1.5 million lives annually across the country. As a result, civil society has reached its breaking point, considering taking the state to court for a legal battle to gain the most fundamental of rights, the right to breathe clean air.